Hi, welcome to Diabetes 101, a patient's guide to type 2 diabetes. This is a handbook and video designed to teach you about the basics of type 2 diabetes. This booklet and video were created to give you the basic information to understand and manage your diabetes. Knowledge about diabetes is important because knowledge is power. The goal is to help you understand what diabetes is, understand the different treatments, and understand some of the language and numbers used in diabetes. Diabetes can be confusing and hard to manage because not all people have the same access to healthy foods and may have other conditions that make exercise or lifestyle changes more difficult. For this reason, it is important to remember that there is no one specific way to manage diabetes. I encourage you to speak with your provider about how to best navigate diabetes given your unique situation and that all your needs are met, and that you are given the best chances at success. This text is not meant to serve as any form of medical advice, but is more of a starting point for further education. If you are having a medical emergency, please call 911. First, we will talk about how your body works without diabetes. In a patient without diabetes, blood sugar is kept in a very narrow range. Your body is constantly monitoring your blood sugar and will secrete hormones to make sure that the blood sugar is in a specific range to prevent harm to other organs and structures in your body. When your blood sugar is high after you eat, the pancreas will release insulin to lower your blood sugar to a normal level. Next, we will talk about what happens in your body when you have diabetes. Many possible things, including genetics, diet, weight, exercise habits, and other things, can result in someone getting diabetes. These factors cause cells to be unable to respond to insulin and can cause the pancreas to have problems producing insulin. This causes your blood sugar to be very high because insulin is not able to lower it to a normal level. When your cells and pancreas are not functioning the right way, your blood sugar levels will stay high. Now we will talk about the complications of high blood sugars. It is very important to work with your provider to manage your diabetes and keep your sugars from getting too high. High blood sugar can cause serious damage to your body. Diabetes can result in damage to your heart, blood vessels, nerves, kidneys, brain, eyes, arms, legs, and other parts of your body. This damage can cause heart attacks, kidney disease, strokes, blindness, loss of sensation in your legs, the need for amputation of feet or legs, and other life-changing conditions. Thankfully, with proper management, this is much less likely to happen. So how do you manage your diabetes? There are several ways to treat or manage diabetes. There are lifestyle changes and medications. Lifestyle changes are things that everyone should do, such as healthy eating and exercising. Medications are to be used along with lifestyle changes. The first lifestyle change we will talk about is exercise. Lifestyle choices play a big role in diabetes. When a person does not exercise and eats an unhealthy diet, they are more likely to develop diabetes. If they do not change their lifestyle, their diabetes is likely to be worse. When people hear exercise, they immediately think of going to a gym. However, this is not always true because there are many ways to exercise. Exercising can be anything that increases your activity. The recommendation is to get 150 minutes a week, or 30 minutes a day for 5 days. Here are some tips for exercising. First, start small. Do something physically active for 5 minutes a day. Try this for a week and then go to 10 minutes the next week. You can work your way all the way up to 30 minutes a day. Second, find things that you like. Maybe you like going to the gym or group classes. Maybe you would rather walk down the street or to the mailbox and back. Maybe you have a friend or family member who you can walk with. Find something that makes your heart rate go up and make it a part of your day. Third, make it a habit. It will be difficult at first to change your current habits, but it will be worth it when you start to feel better and see the positive changes that exercise can have in your life. Now I will talk about diet and nutrition. The food you eat and the drinks that you drink impact your health and blood sugar. My goal is to give you a foundation for understanding how food impacts your health and how you can use food for your benefit. First, carbohydrates or carbs turn into sugar, which increases blood sugar. Paying attention to how many carbs you are eating will help you manage your blood sugar. Second, do not eat a lot of added sugar or processed foods or drinks such as soda, juice, sweet tea, white bread, cake, cookies, candy, chips, or sugary cereals. These will make your blood sugar be higher because they are carbs. One way to try and eat healthy is the diabetes plate method. Half of the plate is non-starchy vegetables such as broccoli, cauliflower, carrots, celery, leafy greens, green beans, peppers, salad greens, squash, or tomatoes. 1/4 of the plate should be lean protein such as chicken, turkey, eggs, fish, shellfish, lean beef, pork, deli meats, or cheeses. And then 1/4 can be carbohydrates such as whole grains, brown rice, pasta, tortillas, starchy vegetables such as green peas, potatoes, sweet potatoes, butternut squash, beans such as black, kidney, or pinto, fruits, and then dairy such as milk or yogurt. And then for your beverage, drinking water or zero-calorie drinks would be best. You may find it difficult to fix meals using this method. That is okay and understandable because it is difficult to balance life, family, work, etc., and make the right choices all the time. It's very important to understand that you are not expected to be perfect. Changing habits and finding ways that you can make healthy changes takes time and effort. Take pride in the small steps you are taking towards reaching your goal of eating healthier. Think about small steps such as eating a vegetable instead of junk food. Start out doing it a few times a week and then work up to more often. Choosing something healthier at the restaurant instead of an unhealthy choice is another way to make a small step. Choosing a grilled or baked option instead of fried. Choosing plain vegetables instead of having them covered in butter. Ask about healthy options at restaurants such as salads, or adding another vegetable or eating fruit for dessert. If the portions are large, you can save some of it for lunch the next day. The American Diabetes Association, or ADA, has a lot of information on nutrition, and you can find that at this link. Now we will talk about the different medications that you could possibly be taking to manage diabetes. Look for yours and circle it. Ask your provider any questions about your medications if you have them. First, we have insulin. There are several different types of insulin, and each type serves a different purpose when managing diabetes. If you are started on insulin, you should have the proper education and feel comfortable giving yourself insulin. There are multiple options that can help with mealtime or basal insulin. Rapid and short-acting are good for mealtime, while intermediate and long-acting are good for basal. For rapid insulin, you have Lispro or Humalog, Aspart or Novolog, Glulisine or Apidra. For short-acting, you have regular, which includes Novolin R and Humulin R. For intermediate, you have NPH, which includes Novolin N and Humulin N. For long-acting, you have Glargine, which includes Lantus, Basaglar, and Tuheo, and you have Detamir, which includes Levemir. The side effects for insulin include low blood potassium, symptoms of low blood sugar if you take too much insulin or don't eat enough carbs, which can present as being anxious, sweaty, confused, having nausea, feeling shaky or weak. There is a possibility of weight gain with insulin, and insulin can cause low blood sugar. The next category is metformin, which includes Fortamet, Glucophage, Glucophage XR, Glumetza, and Riomet. The side effects of metformin include nausea, vomiting, diarrhea, upset stomach, and should be used in caution in patients with kidney and liver disease. There is a possibility of weight loss with metformin, and metformin does not cause low blood sugar. For sulfonylureas and meglitinides, the medications include glyburide or Glinase and Diabeta, glimepiride or Amaryl, glipizide or Glucotrol XL, repaglinide or Prandin, nataglinide or Starlix. Possible side effects include that these could possibly be an issue with those who have sulfa drugs. There is a possibility of weight gain with these drugs, and they can cause low blood sugar. Thiazolidinediones, or TZDs, including pioglitazone or Actos, rosiglitazone or Avandia. The side effects include possible increase in fluid, which could worsen heart failure, so this should be used in caution in patients with heart failure, and it can also cause leg swelling. There is a possibility of weight gain with TZDs, and these do not cause low blood sugar. GLP-1 agonists include exenatide or Byetta, liraglutide or Victoza, dulaglutide or Trulicity, semaglutide, which includes Ozempic, Rybelsus, and Wegovy, and tirzepatide, which includes Mounjaro. Side effects include upset stomach, nausea, vomiting, and diarrhea. There is a possibility of weight loss with these drugs, and they do not cause low blood sugar. The next group is DPP-4 inhibitors, sitagliptin, which includes Januvia, saxagliptin, which includes Onglyza, linagliptin, which includes Tradjenta, and alogliptin, which includes Nesina. Side effects are upset stomach, nausea, vomiting, diarrhea. This is neutral in terms of weight gain or weight loss. These do not cause low blood sugar. SGLT2 inhibitors, canagliflozin, which includes Invokana, dapagliflozin, which includes Farxiga, and empagliflozin, which includes Jardiance. The side effects are UTI, yeast infections. There is a possibility for weight loss, and they do not cause low blood sugar. Alpha-glucosidase inhibitors, acarbose, or Miglitol, also called Glycet, have side effects of upset stomach, diarrhea, and gas. They are neutral when it comes to weight gain or loss, and they do not cause low blood sugar. Amylin mimetics, pramlintide, have side effects of upset stomach, nausea, and vomiting. There is a possibility for weight loss, and they can cause low blood sugar. Now we will talk about different numbers, tests, and exams that will happen when you have diabetes. These are important to understand so that you know what the provider is doing and so that you can see how your diabetes is improving, worsening, or if you're developing any complications. First is A1C. This is a blood test that can diagnose and monitor diabetes. The percentage result gives the healthcare provider an idea of where your blood sugar has been averaging over the past few months. As you can see in the chart below, 6.5% is the cutoff for a diagnosis of diabetes. If you have diabetes, then you should work with your healthcare provider to come up with a goal A1C. Normally, less than 7 is a good goal, but you should work with your provider to determine a goal that is right for you. A lower percentage means your blood sugar is better. You will have this measured every few months to make sure that your treatment is helping to improve your blood sugar control. Next is blood sugars. Blood sugar numbers can show how treatment is working and can be used daily to make sure that your medication is working. It can also be used to make sure that your blood sugar does not get too low. A good fasting value, which is before eating or after sleeping all night, and is defined as a blood sugar taken after not eating for 8 hours, is 80 to 130. Next, we'll talk about protein in your urine. Diabetes can damage the kidneys, which causes protein to be in your urine. Measuring the protein can show the provider how damaged your kidneys are and monitor it for changes. Next, we'll talk about the eye exam. Diabetes can damage the vessels in your eyes, which can cause blindness. A yearly exam can be used to monitor for changes. Next is the foot exam. Diabetes can damage your feet and nerves, which makes it harder to know if you have a wound or sore. If this wound is not recognized, then it can become infected and lead to the foot or leg being amputated. This exam lets the provider see how your feet are doing. We hope that this handbook and video provides you with a good baseline knowledge about diabetes. We encourage you to speak with your provider about diabetes and to work with them to create a personalized plan for you so that you can successfully manage this condition. Feel free to take notes in the handbook about questions or concerns so that you can ask your provider at your next visit. Thank you for taking the time to listen to this video and read this handbook.